I think the previous presentation by Okan was very nice and comprehensive, although there were no slides. You can combine my presentation with his, actually, the future AI and the recommended works by AI. Can we use can we use virtual reality with that in some therapies on treatments? Thomas Insel. I think it was in 2014. He was transferred by Google Microsoft, just like football transfers. There was a great deal of money behind the scenes, most probably, and he went to Google. I think it was 2 or 3 years ago. He established his own company. Why that was the process? Why is it related to us? Most probably, during the future 10 years, the applications will be quite different in line with the technology. This change will be coming. Therefore, holding such a panel in this Congress is quite precious. Here the ambient is really nice. There is the weather, the sea, everything is good. And thank you very much for your participation, by the way, to the panel. But for everyone, at least during the future 10 years, for many structures over the world, many things will be changing. I worked in the virtual reality field, and Faik Bey is holding sessions on this issue. Faik Bey says that maybe furniture companies or many other sectors will be out of the circuit because you will be wearing your goggles and you will be seeing the desired furniture order at your home, and you will be spending that evening with the furniture you want, and the robots will give you some recommendations about your spouse or wife or husband. Maybe the life will be changing. Maybe we will be downloading the mail on our tablets. I don't know. Now it's in the process of trying. Phase 1, phase 2, phase 3 studies are going on. These are the applications by medicine companies. Not only the medicine, there are also the technology companies. They're applying new models. What do they do? Currently, as also mentioned by Okan, they are collecting data. Where they are collecting this data? From us, from our mobile phones. For example, in Istanbul, you are curious about a land, you want to buy a house, and for the first time you enter your data, you browse, and many advertisements, many commercials are seen because we are tracked, we are inspected, and there are many processes behind this. In the collection of these data, this will be influential on the general healthcare system and psychiatry. And there will be changes depending on this. There are many digital phenotype forming studies. For example, a schizophrenia patient, how often does he or she send messages over the time? How often do they go out, or do they go and eat somewhere else? These data are all monitored by the technology companies and medicine companies. One of the most significant problems in our field is that we are developing programs for our patients, of course, but do our patients use the current technology? This is a study from abroad. Normal population uses technology at this level, and this is by year, the development by years on the horizontal axis, and the patient's use of technology is indicated with the blue line, and they are very close to the normal population, and in time they have increased their use of technology. This is our study conducted in Izmir, the schizophrenia patients. How was their relation with the technology? How often they were using mobile phones, tablets? 86% of the patients had mobile phones, 67% used computers, 67% have Wi-Fi's, and 65% of the patients were using social media actively, and most frequently they were using WhatsApp and Facebook. More than half were using video calls, and these patients, especially the ones using the social media, were younger patients, and they had lower negative symptoms, and their cognitive functions were better. Maybe they are more prone to the digital technology, and one probability may be the use of digital technology may have a positive impact on the symptoms. We do not know. What is artificial, what is virtual reality? You wear your goggles and you see and experience a world around you, but which is not real. I do not know whether you have experienced it. You may wear your goggles and go to Florence, and you may act as if you were living there. Today, regarding virtual reality, the technology developed in this virtual reality is quite similar to the past technology. The mobile phones in the past were really heavy, and they were just used for talking on the phone or calling. You now we have mobile phones. We do thousands of operations over our phone, and we have many applications, and maybe our phones will be rubbish in the near future. We will be using virtual reality goggles, and there will be such a transformation. But this requires two things: they must be cheaper, these are expensive at the moment, and secondly, ethical issues must be uh, managed, because when I wear some HoloLens, I can check anything. I can retrieve some data from anywhere. Therefore, some ethical issues must be well managed and audited. Many technology companies at the moment are trying to develop virtual reality goggles. What is their purpose? Using a computer, they are imitating the outer reality and making the person live in that virtual world. Augmented reality applications are also there. You are not only watching through Googles, but with the smell, with the movements, with your actions, you live that reality in a three-dimensional manner. And again, this is a slide I got it from Faik Bey 2 years ago. $33 billion investment was done for virtual reality or augmented reality. I think the budget has been three times of the day for today. For schizophrenia, what are the applications in relation with virtual reality? When the works first started in schizophrenia, the first criticism was that whether they will exacerbate the psychotic tables in the patients, because the patients will be in a virtual environment, their perception will be the virtual environment, especially for the paranoid patients. Will there be a problem? But on the contrary, when among the adolescent patients, no psychotic exacerbation was seen. However, in the awaited therapy for the awaiters, some paranoid thoughts may be developed in the patients. However, in many fields at the moment, schizophrenia patients can use virtual reality applications comfortably. Many of the patients consider it fun, and I will show you the results of a study in relation with this. In our field, another important point where virtual reality is used is the diagnosis, especially neuropsychologic tests are efficiently used with virtual reality. Many tests are done using that VR, and there are some early studies regarding this. Another study by KIF team, through virtual reality, they improve the cognitive functions of the patients. VRF CAT is the application. In different atmospheres, in kitchen, at bus stop, at a grocery store, the patients go there. Through virtual reality, the patients go there and they adopt, especially There are also some scales evaluating the response of the patients with this VRF-CAT study. What can be done? Psychosocial functionality of the patients is increased, for example. In the study, you see a virtual reality city, and the patients are provided some tasks in this province. For example, they are instructed to go from somewhere to somewhere, spend time at a cafe, or go shopping to a grocery. So some cognitive functions are scaled and evaluated in this study. The early studies show that there is a serious improvement in the concentration and memory, but there is no change in the planning and executing works. However, regarding the social functionality, there is a significant increase, and the chronic patients taking part in the study consider these applications very beneficial, and awareness has been raised among the patients, as shown in the study. Another application here, you are given an address, and the patient is instructed to go to that address. And at the time when he or she gets on the bus, the patient is required to read the facial expressions of the other passengers on the bus. And here, for example, you see the results. Paranoia is decreasing. Obsessive compulsive symptoms are decreasing, especially the depression scale. The depression level is also decreasing among the patients. And this is a past study regarding, it was in 2011, I think, when it was published. In this study, as you see here, there are animations, and in different environments, the patient's capabilities are evaluated through virtual sessions like face-to-face interviews, knowing the emotions, recognizing the emotions. Such sessions are held. As a result of this study, one of the findings is that the schizophrenia patients are clearly participating in the sessions, and they find it quite beneficial, and they pay interest in these sessions. And in many of the fields, like vocal skills or conversational skills, entrepreneurship, in these areas, there is a great increasing interest. Only in nonverbal skills, there is no change. A similar study, there is a cafe or grocery, and when the patients are in that environment, the patient's cognitive capabilities are evaluated, and the functionality of the patient is evaluated after a few sessions. The finding is that the pre-treatment levels and after 10 sessions and during the 4 months follow-up, some changes are evaluated. In many of the fields, there is an improvement in psychosocial functionality or psychopathology. Within 4 months, this improvement is continuing, and it is sustaining actually for the patients. And what do we do? Ilgan is my PhD student. You see a patient. This is a session in virtual reality, with virtual reality. Now, our shootings are quite, our footage is quite different from the virtual reality thing. Actually, we are using real people, real environments, and we do three-dimensional footage, and this footage is open for interaction. We want our patients to improve their interaction skills. What have we done? The first thing was quit smoking treatment. We have developed 10 sessions, especially after the sessions, schizophrenia patients and normal healthy people have reduced their nicotine dependency. there was a great reduction. However, that study was completed before the pandemic. We wanted to do follow-up, but due to the pandemic, we couldn't. And with virtual reality application on healthy people and on schizophrenia patients, there was a great improvement in quitting smoking. And there are also other studies, but these are mostly in animation style, and generally the craving after quitting smoking is the main topic for some of the studies. Our study is patented, by the way. Our second study is regarding psychosocial functionality. And here you can see a tram in Izmir, which is very fun actually. We did some footage for this tram, and there are patients, and this is a supermarket, in a cafe, in a family life. The interactions are all recorded, and these are included psychosocial functionality program, which is composed of 10 sessions. We published the first part of the program. There is a significant improvement in the psychosocial functionality. This study included 7 patients, especially 2 improved very well. 1 patient worsened, and at the moment, the study is ongoing. In conclusion, web-based applications, smartphones, and virtual reality treatments will be more used in the future, and they may be useful for the evaluation of the cognitive situation and functionality of schizophrenia patients, and also in order to improve the negative symptoms, they may be very useful. Chibitak and BAP projects supported our study. This is my team. Thank you very much for your attention.